The World Food Program warns that ongoing hostilities, damaged roads, and the lack of public order and safety have severely hampered food transport operations in Gaza, forcing WFP to reduce rations. WFP urgently needs fuel deliveries, increased flow of food supplies, and greater capacity to deliver hot meals, particularly in Gaza City and North Gaza. The agency says they reached some 1 million people in Gaza in July, but stressed that food distribution points continue to face major disruptions due to conflict, evacuation orders, and damage to infrastructure. WFP warns that it will be unable to bring in the quantity of food required this month unless more border crossing points into Gaza open and aid workers are able to reach people safely and at scale.
For more on this, Dr. Paul Spiegel joins me from Baltimore in Maryland. He's the director of the Johns Hopkins Center for Humanitarian Health and a professor of practice at Bloomberg School of Public Health. Doctor, thank you for your time. We really appreciate it. When we hear the UN saying that they may not be able to get enough food into Gaza this month, how much worse will that make the humanitarian situation in an area that is already in dire need of assistance?
Yeah, it's a horrific crisis. I think I don't think any of us could believe that this has gone on for so long. And so this is any sort of lack of food, lack of water, lack of medicines is already going to exacerbate a situation which is already unbelievably serious. So of course it's going to have a very negative effect.
And it's incredible, as you say, that this has been going on for 10 months now. In October, we're going to be approaching a year. And you've worked on reports that developed models to project excess deaths in Gaza, both direct and indirect. And these reports were to also inform decision makers working on the humanitarian aspects of this war. Can you talk us through these reports and what they tell us now about the crisis as it stands?
So thank you. We worked on this together with the London School of Hygiene and Tropical Medicine and Hopkins. And the first report was to project, not to predict, but to project what could happen if there was a ceasefire, if there was the status quo continuing, and or if there was an exacerbation. And the numbers were extremely high, particularly for trauma deaths, as we're seeing today. We then looked at what we call indirect deaths, which are the deaths due to non-trauma related diseases. And I don't think yet, because of the lack of a very, very strong system right now, I think we're missing a lot of those deaths that may be due to those who are dying because of lack of renal dialysis or diabetes or cardiac disease. What is reporting at this point is primarily still the direct horrific numbers of deaths due to trauma.
This is what is really frightening about all of this for many of us who have been reporting on this story since it broke on October 7th, is the fact that you have these direct strikes from Israel. They're killing people, which you describe as the trauma deaths. But then it's everything else that is happening in terms of the humanitarian situation there, the lack of food, water, basic medicines, that the epidemics that are happening in Gaza are increasing the risk of death for many people there, especially children, which the UN has called this a war on children. And as we've seen, so many young people have died and are now also living with that trauma.
Yeah. So before doing these projection reports, I did work with UNRWA. I was in the region in Jordan and Egypt in November, December, working with them on the Gaza crisis. And even then, we were quite concerned about the water and sanitation situation. But the situation now is so severe that the numbers of diarrhea cases, both bloody and watery, but particularly bloody, are increasing. The numbers of hepatitis A, there's reported now over 40,000 cases of hepatitis A, which is a waterborne disease. And most concerning, and this was our biggest concern early on, is polio, polio and cholera. And so polio now has been found in the circulating in the water due to oral polio. So it's a vaccine-derived polio that could cause polio cases, which is extremely concerning. And we're waiting. Luckily there has not been cholera introduced in Gaza for a long period of time, but there has been in Lebanon and other areas. And so if there is a cholera outbreak, the situation is so dire, it's going to be almost nearly impossible to respond despite tremendous preparation because of the lack of the lack of water and sanitation that is available.
So even if there was a ceasefire called tomorrow, it would still take a very long time, you're saying, then, for agencies and health officials, those working in Gaza, those coming in, to try and alleviate some of these problems, especially when we look at cases like polio, cholera, Hep A. How contagious are those diseases?
Yeah. So in our first projections report, we talked about a ceasefire, and there we saw that rather quickly the numbers of deaths due to trauma will reduce, but even then they will not end, even if there was a ceasefire with no more bombing. And that's because you're going to still have unexploded ordinances, and you're going to have people that were still injured who still may die due to infections because of poor health care. But then it's going to take a fair bit of time, even in a small place like Gaza, to be able to restart the sewage plants. For example, as many 70% of the sewage pumps are no longer working, and none of the wastewater treatment plants are working. So this can't be fixed day one. It's going to take months. There are only 16 partially functioning hospitals out of, I think it was 34. And so it's going to take time for this to occur, and that is going to be an extremely vulnerable time for everyone, children, women. We haven't talked about how many women may have died in childbirth or from lack of care or not getting to a hospital who in need of a cesarean section. So all of this is going to take time despite the preparation that has occurred. There's a tremendous amount of preparation that has occurred, but it won't be immediate.
And Doctor, I'd like to look at the various groups that are helping in Gaza. We've got UN agencies like UNRWA, you mentioned earlier, UNICEF, World Food Programme. They have a lot of influence and a key role to play in helping Palestinians, and as they always have. But there are also other aid groups in the Strip. Is there cohesion and cooperation among these groups?
There is, I would say, compared to many other settings, there is cohesion because sadly not that many are allowed to go in. So what happens in many other situations is you have many groups going in at the same time, and there's a lack of coordination. Because of the insecurity there, it's not possible to flood Gaza with the numbers of NGOs and UN agencies that are likely needed, number one. Number two, though, is that, and this is something quite important, is that Gaza pre-October 7th had a very strong health system with very strong health workers, very well educated. And so one of the issues is, of course, they're going to need a lot of support, but we also need to make sure that the international community comes in an appropriate manner that supports the healthcare workers in Gaza and doesn't sort of overtake them, because we want to make sure that they are supported and that they are able to continue to support their people despite all of these very difficult, almost unimaginable circumstances.
The resilience of those healthcare workers in Gaza is absolutely incredible and so admirable. Dr. Paul Spiegel, really appreciate you taking out the time to speak to us and bringing us your expertise. Thank you.
Thank you very much.